Can love take place between a doctor and a patient? Patients fall in love with doctors at every turn, especially psychotherapists, gynecologists, and plastic surgeons. And that can get a doctor's license revoked. And I almost got in such a situation. One of my patients, a pretty lady, tried to seduce me, but I stopped in time. I realized it. The charges are simple and very similar. The doctor, taking advantage of the patient's trust, using clinical information and her innermost secrets, seduced the unfortunate woman and had sexual relations with her. It is the doctor who will be blamed, not the lady. He must have been the one who seduced her. And then, after a while, of course, the love went away. Otherwise, how would they know about the act? An act that discredits the medical profession and grossly violates medical ethics, and may even be the end of a medical career. There's no place for such people in medicine. If you want, go into the breeding of rabbits, cut off and sew their legs in the shed at night while the neighbors do not see. Or go as a medical representative in a pharmaceutical company, where you as an experienced clinician will be very appreciated, but behind the eyes, of course, will be called surgeon loser who slept with his patients. That can make you cry into your pillow at night. But it is much more difficult to live when you dream about surgeries that you can never do again. But can dream in that first date, forbidden meetings with his former patient, when she brought you flowers, looked with admiration at your hands, gently whispered in your ear thank you, doctor, and so sensually smelled of perfume mixed with sweet tears from the overwhelming emotions, that it was quite impossible to resist it. Yes, you have never been so admired before, nor looked so devotedly in the eyes. And after all, you are almost 40 years old, and you had already doubted that such things happen only in movies or novels. So the feelings came flooding in. Is it ethical, you ask yourself, unbuttoning her bra on the couch in your apartment or office? Of course it is. It's love, and is love unethical? And then you merge with her in a long, dizzying kiss and feel like you're falling into the abyss. But that's all in the past. There was no love. But there may be a letter to revoke your license for sexual harassment and malfeasance, and a bottle of her perfume left at your house. That could happen. You're not a doctor anymore. Some women are cunning. They'll get the naive doctor into bed and then blame him. She wears special stockings for the doctor and uses seductive perfume. But the doctor shouldn't be falling for these tricks. There may be gifts for the good doctor. In such cases, the doctor should have a nurse on hand, and the doctor should talk more formally. Let the patients think the doctor is impotent or a fool. It's better that way. Let the doctor's charisma, charm, sex appeal, and power over the patient, given to me by my profession, remain with him. And let the lady look for a man for lyrics outside the clinic. By the way, the analysis of court cases concerning sexual relations between a doctor and a patient has revealed a number of very interesting patterns. In most cases, the doctor accused of having sex with the patient was able to successfully cure the patient of the disease with which she initially came to him. In the eyes of the grateful patient, the doctor became almost superhuman. Have you ever been considered superhuman? Try it at your leisure sometime. It's a feeling you can't mistake for anything else. I'm pretty sure the superhuman feeling zone in the brain is right next to the orgasm zone. Well, surgeons will understand. The most seduced, by the way, were married doctors of surgical profile over 40 years old, who have achieved significant success in their field. And it's not just age-related changes, I think, and all the cases are very similar. The consultations were informal and relaxed. Between the doctor and the patient there was a zone of special trust, and imperceptibly erased the boundary beyond which medicine ends and romance begins. Then the romance, as a rule, ended and everyone suddenly remembered who they were. Only to this realization already mixed resentment, jealousy, pain, and often the desire for revenge. No, it's bad form to desire a patient. For example, such a question. A woman who first shows everything and then tells everything, how interesting can be. Male gynecologists must have a professional split personality. Walking down the corridor, he may notice beautiful legs, figure, but as soon as these legs and figures are in the workplace, except for symptoms and syndromes, the doctor should not see other things. Sexologists get 3 direct offers a week, at least 3 a week. He's a specialist, he knows everything, he knows how to do everything, he'll get laid in a special way. Yes, having an affair with a patient is taboo for an attending. It interferes with his work, hurts his career, although, of course, there are doctors who married their patients. Apparently, their relationships have gone far.